Hello, my name is Rob Collewijn. I want to explain the concept of pain to you today. And I'm a physical therapist, so I'm approaching it from the musculoskeletal viewpoint, which means that I am addressing the functions of the muscles, the joints, the bones, nerves, etc. that have to do with your physical functioning and movement. Alright? So I'm going to use some analogies to describe it to you, but this is a very simple way of explaining pain, looking from factors and engineering wise. So here we go. So I will take one block, and I chose a block because the body is a carbon oxygenate machine. Okay, so you eat carbs, you breathe in oxygen, that creates energy and heat. So that's why I used the block. Okay, and this block represents a fairly good, happy person. Okay, and the purpose of physical therapy is to improve the function, to bring it to most optimum function a person can do and use in his life. Okay, so this block has an intention to go from A to B. Okay, and this block representing a body has certain functions, and these functions are going to help the movement from A to B go smooth if those functions are all coordinated. Now, because it's a block and it's sliding over a surface, you create friction. Okay? The block is going to slide, you're going to get friction and shear, and that creates heat. Okay, now, this is some heat that forms, but that heat is formed at a temperature of 98.6 degrees Fahrenheit, which makes also this become part of an ideal, because that's the optimum way of moving and functioning temperature of the body. Okay? Now, if you look at that particular point, 98.6 degrees Fahrenheit, you go 5 degrees higher, you're at 103 degrees, and you're not moving so good anymore in a specific joint or the body. Or you go 5 degrees lower and you're at 93 degrees, and you're also not doing so good because now you're closing into hypothermia. Okay, so a body's optimum function, therefore, is maybe 1 degree higher or low, and it's a thin line. And it's quite miraculous, actually, that a body stays on that thin line when it functions. Okay? Good. That was a little side note on that. So I cleaned the board, and now we're going to address the other block. And this represents a block of, unfortunately, not so happy person. Okay? This block also wants to move from A to B, just like the other, with that intention. Okay? However, this is a person that isn't so happy because he is in discomfort. Okay? Now, this block has also some factors that help pushing him in the direction of A to B. The problem is these factors are not all coordinated, and some of the factors in the body don't function correctly, so they actually start also pushing against him. So you get a little bit of a contest going on. Where do I go with my functions? Therefore, this block doesn't slide smoothly over the surface. Analogy would be an older gentleman or woman walking and take a few steps, take a break, take a few steps, take a break. Or you get somebody running against a resistance, so you exert more energy. As a result, you get more friction over here. Okay? And that more friction equates to more heat and swelling. Now, that results in inflammation. That's an inflammation. Now, inflammation manifests itself in the body as this wonderful word, pain. Okay? And so, what we're trying to do in modern medicine is we're going to attack this inflammation because we cannot have pain. So we're going to use on this inflammation ibuprofen, anti-inflammatories, pain medications, ice, heat, creams, injections, and even to the point that we do surgery. Now, as you know, anti-inflammatories work, so the inflammation goes down, but because you're still having these functions working against it, if you do more function, it comes back. And that's why it continuously happens. You might take some extra medication, a little stronger. That will work for a little bit, but the disease will be dormant, or the dysfunction will be dormant, because this continues to happen. Now, to explain then what therapy is doing, we want obviously an optimum function. So what we're going to do in therapy, we're going to take this function and bring it over that way. And after that is handled, we're going to bring this function and bring it over that way. Now that's what we call reparative and corrective therapy. Okay? So it means repairing because you're bringing the function in alignment, or you're correcting the function so that it can align again. And we'll get more of this viewpoint. Okay? Now, if you want to enhance this person, all you have to do is make those factors longer and stronger. And that you can call enhancement therapy or preventative therapy, in the form of if you make the body so strong that if there's any counter effort or counter factor happening, this gets nullified because the body is so strong, and that's called preventative therapy. Okay, now, then you're asking yourself, okay, what are those factors that make a body move? Well, then we get into the technology and the philosophy of physical therapy, and I don't want to talk with you about that right now, but I will do some more videos on that later. Okay? So this is how we look at pain, and how to eliminate pain is not per se immediately working on the inflammation. That is a temporary solution. A permanent solution is restoring the functions where you have no inflammation, so no pain results. So thank you for your attention.